So our conversation tonight is with 8 members of New York's congressional delegation.
8 members of Congress, Democrats and Republicans, coming together, sharing their plans and ideas on what's best for the people of the state of New York in the wake of the COVID-19 pandemic.
Whether it's a person who you talk to on a telephone who has just lost his wife to the COVID virus, or whether it's a frontline worker trying to get PPE so they're not afraid to go back to work, or whether it's a business that's sucking wind and trying to just keep its feet on the ground and surviving. Not one of them has told me or talked about politics at all. They couldn't give a darn less.
Answering your questions.
This is Mark from Elmira, who says federal workers, including Congress, should accept pay cuts or pay trimmed to help balance the loss in the anticipated government revenues. How much, he is asking, would you be willing to sacrifice, and have you taken any pay cuts yourself?
Well, I appreciate that, and I understand the frustration that Mark is saying, and I think we're all in this together. And so if that's something to be considered and proposed, I'm open to it. But I think what we also need to recognize is that we are united in our efforts to get through this.
Looking to get back to Washington.
We'll probably be back in early to mid-May. As you heard, next week is canceled. But I think there are a number of issues to iron out. Obviously, there's been this whole issue of state and local governments and school systems getting funded from Washington. I think that's very important.
And working for the good of the people. Zach Wheeler, 18 News.
New York is kind of unique in that we share the border with Canada, and the border has essentially been closed, and we have tourism season coming up. I want to ask this of Mr. Higgins and Ms. Stefanik. Can you foresee that the border is going to be open in time so the Thousand Islands, the Buffalo area, so people can cross back and forth? And I don't mean our truck drivers and our medical and health professionals. Can you see this happening sometime fairly soon in time for the summer season? Let's start with you, Ms. Stefanik.
Well, I think public health data is going to drive those decisions. And I also think conversations between the two countries are critically important. We do that on a regional basis, but it's going to have to be done at a federal level. You know, we get often asked about a date certain. And I think, again, you have to look at public data over time when it comes to percentage of positive cases, when it comes to hospitalization rates.